I want to say that I was not happy with the governor's decision yesterday because it's very, very clear to everybody that the current wave, particularly in the areas that the news has been reporting on, and now in NCD, is really causing a lot of issues to all of us. Firstly, the death of many, many citizens in the city and in the country. And also the Port Moresby General Hospital CEO did report that 2 children have now died of COVID. And also it's very, very visible in the NCD and reported very well by the media and all of you that the beds are really packed. Staff are really stressed. The mortuary is really full. So they're extending mortuary space, they're extending bed space, and they're asking for staff for relief. That is enough evidence that the system is fully stressed. That is because every day, as you have been reporting, every day cases are coming in. The ambulances are doing 5 times more calls than they've ever done before. The emergency staff are seeing more emergency patients than they've ever seen before. The mortuary staff are seeing more death than they have ever seen before. And so what more do you need? And my call to the governor is, while I agree that the vaccination push is the way to go, that will not solve the immediate problem of the systems being overstretched. We need some relief. And because all of us know that COVID moves from person to person, as people move, as crowds move, then COVID moves. And so the world has demonstrated, and we're very close neighbors, Melbourne and Sydney, just down the south, that lockdowns do help. I'm not saying the tightest lockdown. No, there is a managed lockdown. For example, emphasize on controlling the crowds where the crowds are. Last time that the NCD engaged the police personnel, I was always very happy that the police personnel had tents outside where the crowds were going. And there was very good control. This was only about 3 months ago. That's the type of thing I'm talking about. That where there are crowds, the social distancing orders cannot be met without police presence. Because our people are traditionally social beings. And so when you just give an order without policing it, people never listen, and we know people have never been listening. This is why the wave, particularly with Delta variant, we are in real trouble right now. So I really feel sorry for the health staff who are there 24/7. I really felt sorry for not only for them there all the time, but mentally and spiritually. They are really, there's a lot of pressure on these human beings called health workers. And so I believe that the way to help at this stage, next 2 weeks, is to have a lockdown, a managed lockdown. And particularly buses, control how many passengers, churches, stop going to church, just go pray in the house. Public servants, you have to do phased work. Some staff, 20 staff come in the morning, mid-morning, next in the night. Those type of things can be done. Hotels don't have to close because they're doing very well. Supermarkets don't have to close because they're doing very well. No mask, no service. So those are already there, but in particular is where big crowds are still gathering. No more sport activities, no more gatherings, and orders are already there, but NCD, where the governor is in charge, is failing to police those orders adequately.